Texas faces a severe shortage of primary care providers, a problem that stretches from our rural areas to our major urban centers. The Texas legislature is currently considering a dramatic plan to address this shortage by providing financial incentives for those willing to serve in medically underserved areas. Healthcare providers, patient advocates, and community leaders from the San Antonio area gathered at the Centro Med Health and Wellness Center to lend their support for this historic proposal.
Local health providers hope a proposed bill will heal a statewide staff shortage. Officials say people who live in rural areas like Atascosa or Bandera County, they say they don't have enough health care providers. State House Bill 1876 would supply health workers for those areas. It would create a loan repayment program for primary care providers after they graduate. In turn, those participants would have to commit to a rural area for at least 4 years. The bill would also help uninsured Texans.
They no longer have the insurance, or if they have the insurance, their copay or their deductible is so high, you just can't afford it, you know.
The bill must first be discussed by House members before the Senate gets a crack at it.
Hoy se anunció que está siendo discutida en la Cámara de Representantes una medida legislativa que, según los que la apoyan, podría resolver el problema de escasez de proveedores del cuidado de la salud.
Así es, se trata de la propuesta de ley 1876 presentada por el representante estatal Warren Chisholm, y Mónica Navarro nos acompaña con todos los detalles.
Gracias, Jorge y Brenda. Esta propuesta de ley 1876 permitiría darles como incentivo el pago total de sus préstamos universitarios a los proveedores del cuidado de la salud que trabajen en clínicas de salud pública. Pidiendo que el público hable con sus representantes estatales para que no sea aprobada la propuesta House Bill 1876, los directivos de la Clínica de Salud Pública Centro Med hablaron de la situación crítica de la escasez de proveedores del cuidado de la salud. Más de la mitad de los condados de Texas sufren de esta escasez, pues los proveedores de salud prefieren prácticas privadas con mejores salarios.
Muchos médicos van a la escuela y tienen mucho que deben, y cuando quieren venir a estos lugares a practicar es porque está en su corazón, pero muchas veces tienen biles que pagar.
En las poblaciones rurales es tanta la necesidad que las clínicas comunitarias ya no están aceptando nuevos pacientes.
En González hay mucha falta de médicos, de dentistas y personas que saben psicología. Y no nada más en González, nosotros tenemos una clínica en Seguín y en Luli, y pediatras son raros.
Por lo que el señor Salas indica que la medida debe ser aprobada. De ser aprobada esta medida, se le pagaría al proveedor de cuidado de salud $160,000 si se compromete en trabajar en esa área 4 años. Además de salario y beneficios de empleo. Y esta incluye no solo médicos, sino cualquier profesionista en el campo de la salud. Los fondos para esto serían obtenidos del impuesto a los cigarrillos, que asciende a $90 millones. A principios del mes de junio se sabrá si esta medida pasará o no. Mónica Navarro, Noticias 41, Univisión.
As a clinic director, I often speak to recent graduates of medical school and dental schools, and they tell me that they have an interest in serving communities of low income. But because of their educational loans, they find it necessary to pursue other opportunities that are more lucrative, because they have this financial debt that they have to manage. If it were not for that debt, they would gladly join our staff and serve in these communities. And so this bill will provide a loan repayment program which will enable physicians, dentists, and social workers to serve in these communities where there is the greatest need.
Local healthcare providers, medical administrators, community leaders, and patients have joined forces to raise awareness of the problem. They're calling on lawmakers to pass House Bill 1876. This bill would establish the Texas Healthcare Access Fund that would pay for additional healthcare providers for San Antonio and surrounding areas.
Texas legislature could bring more doctors to people living in urban and rural areas of Texas. Today in Austin, lawmakers presented House Bill 1876. They say it would create a fund to help medical students pay off their debt if they choose to become primary care physicians in underserved areas of our state. Money for the Texas Healthcare Access Fund would come from a change to the way smokeless tobacco is taxed. It is estimated Texas is in need of 4,500 doctors. Lawmakers say this plan will help encourage more people to become doctors as well. The bill is expected to go before a Texas House committee next week.
House Bill 1876 is extremely important in helping support more positions for physicians that want to practice in this institution such as ours, a community health center that serves several unfunded patients that would otherwise have to go without care.
We urge lawmakers to act quickly to make this program possible for us to be able to do the work we do in these underserved areas.